Welcome to a day in a dental or COHAT, comprehensive oral health assessment and treatment. The patient must not eat any food the night before a dental procedure. All food must be made inaccessible at midnight, and no breakfast should be given. Every dental procedure, or COHAT, begins at check-in, where the patient is examined by the doctor. A cursory exam is performed of the mouth, and a treatment plan is created and provided to the client. It should be noted that this treatment plan often changes during the procedure due to hidden problems under the gum line. The veterinary staff stays in contact with each client throughout their pet's procedure, keeping each client up to date on developments and getting approval for any changes to the treatment plan. After each check-in, the patient has their blood drawn to ensure they are a good anesthetic candidate. Their morning dose of medication is given at this time. Medications include an antibiotic and, when applicable, pain medication. The patient is then put in their own house for the day. Blood work is processed in our on-site lab. The veterinarian will review the lab results and determine if the patient is cleared for anesthesia. When it is time for the procedure, they are given an injectable medication for light sedation. The patient is monitored during the pre-medication stage. Once lightly sedated, the patient is then brought to the dental station. An IV catheter is placed for intravenous access. IV fluids and medications are delivered through this port. The veterinary staff will administer propofol to sedate for intubation. The patient is intubated and hooked up to the anesthesia machine. Every patient undergoing a COHAT will have one veterinarian and 2 veterinary staff members present throughout their procedure. Each patient is maintained under anesthesia with the use of isoflurane, gas, and oxygen. Vitals are monitored and recorded throughout the entirety of the procedure, and adjustments are made as needed. Heart rate, respiratory rate, CO2 level, pulse oximetry, blood pressure, temperature, jaw tone, pupil size, eye position, and pupil and eye reflexes are monitored. Their heartbeat is made audible with a Doppler and the EKG monitor. A ventilator is used to breathe for the patient. The procedure begins with the doctor charting the oral cavity and an assistant taking dental radiographs. A thorough exam in combination with full mouth radiographs give the veterinarian a complete picture of the patient's oral health. Often this is the point where unknown tooth fractures, abscesses, oral tumors, cysts, and other abnormalities are discovered. The dental team will contact the client if there are new findings or changed recommendations from the treatment plan provided at check-in. The client must give verbal approval for the dental team to proceed with the recommended changes. Dental cleaning consists of removing large quantities of tartar or calculus and debris, polishing, and sealing. After the cleaning, the oral cavity is suctioned to remove excess fluid. The gums are treated with laser therapy to promote healing and reduce inflammation. Extractions are performed by the doctor. A local pain block is administered, the bone is burred away, and the tooth is elevated out. Post-extraction radiographs are taken to ensure there aren't any root remnants left behind. The extraction site is then closed with suture. As the procedure comes to its conclusion, the patient is weaned off of anesthesia until the patient is breathing on their own and their anesthetic plane is light. When the patient is cleared for removal from the dental table, they are taken to the recovery area. Their heart rate, respiration, and temperature are monitored by a recovery assistant until they are able to safely walk on their own. The patient is then moved back to their house where they are monitored until they go home. The patient is monitored for nausea, bleeding, and excessive swelling. If any issue should arise, the veterinarian is able to address it before release. At the time of release, the client is taken into a room where a veterinary assistant reviews discharge instructions, medications, the pet's dental chart, and radiographs. The client is informed of what to expect during the recovery phase and how to care for the healing mouth. Each patient will return 2 weeks after their procedure for a recheck appointment. At these appointments, The dental assistant who performed the pet's dental cleaning will examine the pet's mouth to ensure that everything has healed nicely. The client is taught proper home oral care and is provided with VOHC-approved oral health care products. Promoting healthy oral hygiene habits can help prevent future extractions, decrease the amount of future dental cleanings needed, and provide an opportunity for the client to detect any changes in the oral cavity, such as fractures or oral tumors. Early detection of tooth fractures helps to prevent abscesses. From here, it is the client's job to maintain their pet's oral health to the best of their ability. Moving forward, the veterinarian will examine the oral cavity once or twice yearly, just like your own dentist recommends.